some fun with this. Really just like to focus on with these everything you need to know that's changing with us and go over some reminders. Um, with that though, I am going to just kick it off with an introduction of myself. Depending on how long you guys have been doing your ACA universities, you might have seen me up here at this point like 3 years ago, 2 or 3 years ago. I was working with you guys and then I passed it off and then now I'm back. So it's lots of hopping around always on the carrier side, but really happy to be here. Natalie Milas, National Broker Manager for Cigna Healthcare, ACA, under 65. And just fun facts about me. I am from Pittsburgh, born and raised, spent my 20s in Chicago, and just moved to Charlotte recently this year. So those are my fun facts. And I just got married 2 months ago. So that's a little bit about me. Quick view of the agenda. Going to spend a lot more time on items 3 through 5. And as we just kind of have this up here, I would just like to kind of start with my goal for this upcoming open enrollment is to make Cigna ACA relevant again, right? Really just make us a top of mind carrier again. And maybe a part of your top 3, top 5, right? We're not going anywhere, no state exits this year. We're here to stay and just slowly grow and do our thing. We grew a little too fast a few years ago and had to scale back. But now I can confidently say we're back on track and excited to see what this wild open enrollment beholds once we hopefully get some answers any day now. So diving into broker value, I use this slide just as a reminder. We are the only branch of Cigna's government business now as of today. So for those of you that do Medicare, Med Sup, are familiar with the ancillaries, all of that has been moved over to HCSC, Blue Cross Blue Shield, and they are now going by the HealthSpring name. So when you think Cigna Healthcare, besides our group, employer business, really, you're thinking about us, right? And the standalone dental that we also offer as an ancillary product that you have access to selling under your Cigna ACA appointment. We will talk about dental a little bit in this presentation. So just a reminder on broker value. So you guys have me, as your dedicated broker manager. I have an awesome account manager team, Maria and Igioma, who help me support all my agencies. They do all the back office stuff and are mini superheroes, I swear. We have our dedicated broker support team, and then obviously our broker portal, right? Your one-stop shop for everything you need, quote and enroll tools, co-branded marketing materials, in-language material, broker payment, which we launched last year. And then my favorite resource is our Open Enrollment Resource Center, which should be ready any day now. And once we have that, we'll be making sure it's blasted out to all of you. So just diving into member value, some quick reminders, and then we'll go a little deeper on the changes that you need to know about. So still have mycigna.com in the app. Once a customer makes their binder payment, they wait 7 to 10 business days, and then they can register for myCigna. They must use their social security number to be able to register. Beyond that, not many changes there, right? They're one-stop shop again for paying their claims, searching for providers. You know the drill. We'll hit on a few of these, the rest of these in the coming slides. Just also want to give a shout out to our customer service, something we take pride in. And new this year, I'm adding a more personalized approach to it for customers looking for that, very unique one-on-one experience. So one thing that is new for 2026, good news, bad news, up for debate. We are going fully digital with our ID cards. So taking a play from Oscar's book. So with these digital ID cards, we will no longer be mailing them out, except for in Colorado. That's the one state where we will still do that. And so the digital ID card will be available on mycigna.com within the app. And now let's say they don't like this. They don't want the digital ID card. They want a physical card. They can request a physical card within the app, within mycigna.com, or you can direct them to call customer service. We have the number up here on your screen right now, and you could request a card that way. I know perfect world with us going digital is you want the ability to just send them their cards. I get it, trust me. I'd like to say that's coming, and I'm hopeful that it could be, but not right now. And by not right now, I'm saying not in the next year. So for now, this is what we have to work with, and fingers crossed, we eventually get that feature within our broker portal. Calling out wellness incentives, just a reminder that we have these, right? Everyone does fitness club memberships, home delivery meal kit services, discounts on wearable devices, hearing aids, the list goes on. I also want to call out the incentives program. So we used to have Take Control rewards. That is going away. And we are having something new for 2026, but it's still being ironed out. I know it's October 9th, but it's still being finalized. So once we know what that's going to look like, we'll be able to share more info with all of you. But for right now, they're still finalizing those details. But just know we will have a member incentive program. Now moving on to virtual care, and I love to say Cigna does this best because MD Live is a Cigna company. You know how it works, right? We don't have to dive into that. Calling out some newer parts to our virtual care. So last year we added the new e-treatment form. This is where like a customer can fill out a form on what's wrong with them, kind of answer all the necessary questions without having to call in or talk to a doctor. And then a provider gets back to them with their diagnosis, sends their prescription into the pharmacy. And from there, they're be able to be seen without having to actually talk to a doctor, which is pretty cool when you think about it and the busy lives people live. We have routine visits available within virtual care, dermatology, behavioral health, and then new for this upcoming year, we have Visana Health, a virtual gynecology clinic, Heartbeat Health as a cardiology program, and then 9 a.m. Health for those managing diabetes. So basically really putting a big emphasis on virtual care, right? And everything you can now receive with us through MD Live. So diving into pharmacy, just some reminders first. So Express Scripts, go to home delivery pharmacy service. That should be pretty easy to remember given they are also a Cigna company. Accredo's our specialty pharmacy to help those managing, a lot of the tier 5 complex medications. And then in 9 of our 11 states, we have the Walgreens Advantage Network. In Texas and Virginia, so the other two, we have the CVS Cigna 90 Now network. These networks are very similar. They both include each other. They include all of the main brand name pharmacies you could think of, right? Walmart, Sam's Club, Costco, Rite Aid, right? The biggest caveat is for Walgreens Advantage, you cannot go to CVS for a 90-day supply. And then for the CVS network, you could guess it, you cannot go to Walgreens for a 90-day supply. So now we get to I think the meat of the presentation here. And that is our 2026 IFP footprint. So drum roll with what we're looking at. This is the lay of the land. So no exits, want to really drive that point home. 11 states for 2026, and we're adding 20 counties across 6 of our medical states for this upcoming year. So I know it's not much, right? 20 counties is 20 counties, but it's meaningful to us. It's better than nothing, right? We're going to review exactly where this expansion is in each of these states a little later on in the deck. But I just want to call out, it's something, it's better than nothing, and we're really happy about this. And, ideally hope to see even more in 2027. Now, we got to talk dental because 1, we're running a bonus right now. And 2, our dental plans are great. And now it's awesome that it's kind of the only standalone dental tied to the Cigna name. So this map just shows you, our plan availability. We have dental in 49 of 50 states. And then depending on the state, as you can see up here, we have, anywhere from 3, 4 to up to 7 plans. Now, looking a little closer at dental, First one to call out, guys, it is guaranteed issue all ages, available for adults and children, and over 65. And now new with our dental, which is very big, is it can now be stacked on top of Medicare, on top of that Medicare Advantage, right? Even if their plan includes some dental coverage, you can enroll in this as well, which we didn't used to always have this, right? So it is a differentiator. And especially with AEP starting in what, 6 days, we want to make sure that you guys know that this can be an option for even your Medicare customers this enrollment season. Now, another big pro, besides the average premiums you see up there, because I think our rates are pretty fair and competitive, is that we do waive waiting periods with proof of prior coverage. That proof of prior coverage could be any dental under the sun. It could be like a lame preventative plan, and it'll count as something that can waive the waiting periods. We waive the waiting periods for classes 2 and 3 only, not 4 and 5, unfortunately. And the prior coverage requirements, it just has to be at least a year long and no more than 63 days in between the policies. But beyond that, again, the prior coverage can be anything. Calling out our best selling plans you see up here, that Cigna Dental 1500 is number one. Covers up to covers class 4 orthodontia, has a $1,000 lifetime max that stacks on top of that 1500. It also does have a 12-month waiting period, but the nice thing about the orthodontia benefit is it covers Invisalign, and it's available for both adults and children. So that, is a one unique call out there. The other best-selling plan, you could probably guess it, is the Cigna DVH 3500. So dental, vision, and hearing coverage on that plan, no waiting periods and no deductibles for vision and hearing. And then it covers the class 5 implants. And one thing to note with the implant coverage is it covers the device used for insertion as well as the prosthesis, which is pretty unique, I would say, for implant coverage in general. Also just worth noting that, that second row with the dental and vision plan, the dental, vision, and hearing, very popular, especially with those over 50, over 65, and just really worth looking into. Finally, that last plan to emphasize is our nice high annual maximum plan. So you see that 3,000 high annual max, and then a nice, fairly low average monthly premium. Now with that, this plan only covers up to class 3, but the nice pro with this plan is common class 3s like oral surgery, periodontics, and endodontics are covered at class 2. And the benefit of that is if they don't have prior coverage, they only have to wait 6 months instead of 12. Also worth noting with the DVH line, just to bring it back, there are no waiting periods on class 2 for the DVH product line only. Last thing to note, the high annual maximum plan, big selling point is it utilizes the total Cigna network, which is the second largest dental network in the country, over 140,000 dentists. The other two plans utilize the Advantage, which does the job, but it's about 88,000 dentists across the country. So, they have to be okay with what's available in their area. And then just doing a shout out to the dental bonus. So it's live right now until November 30th. If we see a huge uptick in sales, I'm hoping we're going to increase. But once you sell 10 plans, on the 11th plan, the bonus kicks in and it's $25 per plan. They obviously need to stay on the books for 90 days, but it's, a pretty sweet deal, I think, right now, just given it's overlapping at least a little bit with enrollment season. If you, maybe have sold dental since June, don't know where you're at, happy to send a report out, just so you can be reminded. Would be a shame if you're maybe at 8 dental plans, didn't know about this and missed the boat on earning some extra cash. Now, bopping back to medical, we're going to review some medical plan highlights across markets. We're not going to get into the plans. We're just going to hit on really what you need to know. So Cigna IFP is in 4 state-based exchanges: Colorado, Georgia, Virginia, and new for 2026 is Illinois. We're adding an HMO in Florida, the partnered care plan. And with this HMO, referrals will not be required, but the one pro of it is we will be assigning PCPs. So we'll still have the EPO product line in Florida. This is just kind of like allowing us to have two product lines, right? And the HMO is just pushing more value-based coordinated care and is also a strategic move to ideally get us better pricing for 2027. And like a little bit 2026, but a even bigger play for 2027. So really worth calling that out. We're going to talk about the condition specific plans in a little bit. We've hit on a lot of the pharmacy takeaways. Just want to call out, you'll still see the $0 to $3 copays for tier 1 on most of our plans. Copays up to tier 3. Reminder, Cigna on our Cigna design plans has a 5-tier model, splitting up tier 1 into 2 tiers for our preferred generics and non-preferred generics. And then the others we talked about. We also have a new auto refill for home delivery with no fees that's being piloted in Arizona and Mississippi. Calling out some cost share takeaways. We're going to hit on a lot of these, but basically the theme is a lot of first dollar coverage, copay forward plans, inpatient copay per days, ER per visit copays, lab copays. You get the gist there. Now, zooming into that My Diabetes Care, this is a name change. So this is the Enhanced Diabetes Care Plan. It just has a name change for this upcoming year. And this is where we have $0 for preferred insulins and non-insulins, $0 for certain diabetics, supplies, equipment, services, the list goes on. You can see the states up here where this is offered in and the metals. And then from there, on all other plans, besides the My Diabetes Care, we have the Patient Assurance Program. And this is where they pay no more than $25 for a 30-day supply of those preferred insulins or non-insulins, $75 for a 90-day. And this just goes through the list. So usually I'm not one to flash formulary screenshots in a deck, but I did this year because we added 2 new non-insulins to this list that is a selling point, I think, and worth calling out. So we've added Mounjaro and Ozempic finally to this list. So on the My Diabetes Care, they can get it for $0, and then on the Patient Assurance Program, $25 for 30-day supply. It's also worth noting just some of the big ticket items you see up here that they can get for $0 on this plan. That Dexcom G7 sensor, as an example, right? I will call out that usually prior auths are needed for those type of items to get them at $0. Looking at the My Heart Care plan, so think kind of similar to the My Diabetes Care, $0 for heart health benefits, certain medications, you can see the list up there, cardiac ECGs, panels, rehabilitation, and then you can see that this is a pilot for us, only launching it in 4 states for 2026. But if it does well, who knows if we'll take this further for 2027. Then just calling out asthma and COPD support. So you're picking up on a theme with us of really prioritizing, condition-specific care. And so this is a new benefit on all of our bronze, non-standard, or Cigna design plans in all 11 of our states. So what this is a copay maximum for certain asthma and COPD medications and supplies, right? So it's designed so that they pay a lot less, right? So tier 2 medications capped at $20, tier 3 at $95, spacers and flow meters are $0, the deductible is waived. So just like a positive move towards making care more affordable for these type of customers. Now, my favorite slide in the plan section, a great one for you to come back to, and we'll make sure this deck is sent out. We have the 2026 plan highlights across markets. So you can see like where we have $0 PCP copays. This is on base plans, important to note. $0 drug copays, HSA plans, right? Some of them even on exchange, some just off only. The off exchange only plans, I think, kind of reveals maybe states where we're going after ICHRA a little bit more with that plan design. And then you can see the HMO, EPO, and then everything else, we've talked about up to this point. Diving into key market network highlights. So this section is really great to dive into where have we expanded the network, where are we expanding our footprint, and kind of hints at where we'll be competitive. If I'm not emphasizing a state at all on these slides, you can take a hint, right? Probably aren't going to be strong there. Georgia's one of those, right? I'll just be honest. And Texas. So just setting that precedent as we go through this section. Looking at Arizona, expanding into Tucson for this upcoming year and adding Tucson Medical Center. No new changes really for Colorado and Florida worth calling out, but just in general, states with pretty strong networks for us. In Illinois, it's funny, I think a couple years ago, we had like the worst network in Illinois. And I think in 2 years' time, we now have one of the best. So last year we added Rush and Silver Cross. This year we've added Endeavor Health, also known as North Shore. Hopefully it's some Illinois folks on the phone. And just really excited for this network and how robust we've built Illinois up in the last couple of years. In Indiana, we're adding Indiana University to the Indianapolis area. Very happy about this. We had a pretty narrow network there just with community, so this is needed. And then to tie in our Evansville expansion in Indiana, we've added Deaconess. Looking at Mississippi, so we have St. Dominic's Health, which goes along with our Jackson expansion. Super pumped about that one. And then we've added Merit Health Biloxi along the coast, and then Baptist up in the South Haven region only. Calling out North Carolina, Tennessee, Virginia, just states again with great networks for us. Tennessee in particular has a nice statewide network solution that does very well for us. And just a reminder, before making a sale with us, I encourage you to utilize our provider directory and our formularies as your kind of your checking tool before you decide to enroll. I'm basically saying use our websites over like what Health Sherpa has, because that is going to be your most accurate source of truth. And some more key market takeaways. So we already hit on Tucson and that auto refill. Colorado's just been a solid state for us year over year, so we always want to make sure we're acknowledging it. We hit on that HMO in Florida, and then finally in Illinois, a little bit of good news, bad news here. So already pumped about the network expansion. We're also bringing Lake County back, so that's great news there. A little expansion there in Illinois. The one piece of bad news is for Cook County, which I know I'm a Chicago girl, where the city of Chicago is. We are going off exchange only in Cook County. I know it's a bummer. It's a move to really help us get better pricing in 27 with all this network expansion. When you enhance your networks, it makes it hard to get a great price. And we were just so priced out in Cook on exchange. We're like, this isn't even worth it to be on. So we're going on the following year. I want to call out with this that Cook County residents can still enroll off exchange. And then those that live in the surrounding counties, right, Lake, DuPage, Kane, Kankakee, they can still go into Cook County to receive care, right? Obviously, with this nice, attractive network, it covers Cook County, so they can still go into Cook County to receive care. Looking at Indiana, we hit on Evansville, we hit on IU. Mississippi, again, the Jackson expansion is so big for us. Mississippi has just been one of our best states year over year, and just really happy to be able to finally have Jackson in there. Looking at North Carolina, this is our 4th consecutive year adding counties in North Carolina, and we're adding Gaston County, which is west of Charlotte. Want to call out that North Carolina actually has the largest Cigna geographical footprint out of any of our states, which is a pretty cool fun fact. Virginia, we're adding 4 counties in the Richmond area. You can see the names up there. Hoping to do really well in Richmond and just the state in general this upcoming open enrollment. Virginia is like all the talk for us right now. And then just a little ICRA plug, everyone's talking about it. You got to mention it. I think we all know, hopefully at this point, because I'm like this is the third day of your training, what ICRA is, right? I'm just kind of calling out that, you know, Cigna wants to be a carrier of choice for ICRA, zone in on that brand name. We have our off exchange plan design. I'm hoping to grow ICRA business predominantly in Colorado, Florida, Georgia, and Virginia, as well as some of the other states where you saw the off exchange only plans. You know, I'd say the only con with us in ICRA is from an operational standpoint. Payment sometimes can be a little trickier, but we're slowly working on that. And you know, hoping to continue to grow our ICRA business this upcoming year. Rounding out to our last section. Wow, I told you guys I would make it quick but effective. Is broker tools and resources. So just showing a flash of the portal. So here we have quote and enroll. Medical takes you to Health Sherpa, where you also could, that's also where you do our off exchanges through Health Sherpa, especially when you're in the portal. Dental will take you to Dental Pro now. So I don't know, those of you on the call are writing a lot of dental, you probably noticed the dental enrollment platform has changed. So it's no longer if you did any quotes in Express app prior to Dental Pro going live, you can still finish those enrollments in Express app up until December 31st. But new enrollments and quotes moving forward are going to be done in Dental Pro. So just want to drive that point home. And just calling out within your agent book of business, we have writing agent NPN added in and customer number case ID. So that's some new features for this upcoming year. And then just calling out our state-based exchanges. So we have Colorado again, Illinois, Virginia, and Georgia. And then I mentioned earlier the OEP Resource Center. So just a nice ungated website. You don't have to log into, deal with multi-factor authentication. It's going to be your one-stop shop for training, customer-facing materials, plan comparison grids, network flyers, even like social media templates and emails you can send your clients, just meant to help you engage with them. Then some renewal information. So renewals, retention, I think it's like one of the biggest buzzwords of this upcoming open enrollment. So now is the time, right? We're into October where we are starting to get our letters out, email, call, text, and communicate just information on key dates and any action items for them. I mean, the biggest piece with this is you as an agent making sure you're actively renewing. Right? It's not the year to let passive renewals fly by. You want to be actively renewing that book and making sure, you know, if the enhanced subsidies expire, that, you know, they're aware of what their premium's going to look like. Make sure they're updating their financial information. Everything's accurate. You know, couldn't emphasize that more than this current year. And just making sure that, you know, if their premiums are super high now, that you're looking at either alternative options or ways to cross-sell. So when I say alternative options, if they don't qualify for any subsidy anymore, you should be selling this off exchange, right? You know, no reason not to. Often you're going to see a better rate. So looking at off exchange for those customers will be big. You know, maybe you got to buy it down to a bronze. If you're doing that, stacking on some supplemental products, right? Hospital indemnity, accident and critical illness, obviously dental, right? We love dental. And then just make sure you're comparing more than just the premiums this year, because, you know, price and where things land, it's going to be a little wonkier than in years past. Some admin info, just reminders on when payment deadlines are due. 12/31 for the January 1st customers, 1/31 for February. I mean, look, usually we extend this, you know, everyone does. It's like kind of routine every year. But I'd say this year, nothing is a guarantee, and I wouldn't just assume. So, right, try and get those payments in on time for your clients. And then ways to pay with us. So last year we did add broker payment within your book of business. You can filter to a pending enrollment report. that will show you everyone new that hasn't paid their binder. Then within that pending report, you can click on customers, call them up, get their payment info, and make payments for them. So that's really nice. I think especially when it comes to binder, you also, if they want you to do it, can make monthly payments for them within the portal on a monthly basis. The only thing you cannot do within the portal is set them up for auto pay. If you want to set them up for auto pay, you got to do that at the time of enrollment and go to cignaindividual.com/payment. It's also where I think Hill Sherpa directs you to. So if auto payment is your jam to keep your customers on the book, you got to do that with them at time of enrollment. Or they can do it themselves within mycigna.com, pay my bill. Other ways to pay, they can call in, mail it in if they're old fashioned. And then I'm just gonna flash our lovely broker management team. I like to say refreshed and ready because we've undergone some changes in the last year, and I've had a lot of wonderful people join the team this year. And here you can see kind of the states everyone is assigned to. So if you have specific questions about a specific state, I might know the answer, but they would and should know a lot more about their local states. Feel free to reach out to them, jot their contact info down. We also have 2 people that have joined the team, focused strictly on dental. And as we kind of round out these slides, I'm going to start to take a look at the questions. So let's start with the first one. Does Cigna cover composite fillings versus metal? Yes, we do. That is usually a class 2, I want to say. But yes, we do cover them. Implants are covered only on the dental, vision, hearing 3,500. So remember, we showed 7 dental plans. We emphasize the DBH 3,500. That's the only plan that covers implants. I may have missed this, but on the dental is the ortho adult dental. So no, our dental's all ages. So the ortho benefit is adults and children as well. Heck, it could even be over 65 if someone over 65 wants to get braces. Power to them. Okay, so for the HMOs, no referrals are required. Correct. Do they need a designated PCP? They can go to any specialist and network without a referral, but we will, for the states where we have HMO plans and this new product line in Florida, be assigning PCPs. And I'm just going to go to the next slide while I keep answering these. So you guys can jot down customer service, broker support, maybe broker portal, quick links. Does it have to be ICRA or do you have an off exchange plan for everyone? It does not have to be ICRA, right? ICRA and off exchange kind of go hand in hand. But I wouldn't say you have to do an ICRA to do off exchange at all, right? I just think you should be quoting off exchange if they're not qualifying for a subsidy this year, which could be a lot more people, right? So you want to be running that quote off exchange if they don't qualify for the subsidy because it might be cheaper. And it's less expensive usually than on exchange. Thank you for copying the broker when our clients forget to pay their payment. Oh, you're welcome. Yeah, we're happy about that. And glad that I think a lot of our communication has switched to digital, so we're not blowing up your mailboxes anymore, your physical mailboxes. How many implants can a patient have per year? The bone grafting, I might have to take that one away. I haven't gotten that specific question before. I would say, I mean, they can get as many implants covered as they want. I'd say with the allowance we have, it's about 2,000 plus hitting your calendar year max for that plan. It probably covers one full implant completely. So then you're kind of paying for the other. That's just how I've looked at it, right? So really, like in terms of full coverage, not having to pay 1 implant a year, I would say. And then just keep in mind with that plan, no matter what, they're going to have to wait the 12-month waiting period before they can use the implant benefit.
Natalie, you rocked it. And this slide is the best slide to have up because everybody inevitably asks for all this stuff. So this is a really good slide to have. But we really appreciate you taking time out this morning, being the opener for us today, getting us
Yeah.
going, so thank you so much for that. It doesn't look like any more Q&A questions, so if you don't got anything else, I mean, you're free. We'll take a quick break until the next presenter is up. We're all about it.
Okay, awesome. Yeah, thanks guys. Appreciate all the questions, engagement, and happy selling this open enrollment.
Thank you so much, Natalie. We really appreciate you. All right, guys. So what we will do now, we'll take a quick break, guys. We will come back at the turn of the hour, so at noon Central Time. We will then have Molina coming on. So it'll be Molina coming on and talking with us at the turn of the hour. And then the hour after that, we will close today with Health Sherpa coming on. And so we can get a lot of questions about how's this carrier tying in here and all this stuff and what those processes are, all that. So thank you for being here, guys. We will come back at the turn of the hour, so about 20 minutes, just over 20 minutes, give or take, with Molina. Thanks, guys.